Imagine you wake up at 3 in the morning. There's a sharp, deep pounding pain coming from inside your tooth. You can't eat, you can't sleep, you can't think about anything else. Now imagine that pain, but you live 50,000 years ago. No dentist, no painkiller, no emergency number to call. What do? How did ancient humans treat a toothache? Here's something wild. For most of human history, toothaches weren't just painful. They were dangerous, they could kill you. A tooth infection that spreads to your jaw, then your throat, then your brain, that's how people died. And yet somehow, ancient humans not only survived toothaches, they actually tried to treat them. And some of those treatments were clever. Some were useless. And some were absolutely insane. But here's the real question nobody asks. Before the dentist, before the drill, before even basic medicine existed, what did people actually think was causing the pain? Because once you hear their answer, you'll understand why everything they tried made perfect sense to them. And you'll also understand why none of it really worked. Okay, here it is. For thousands of years, from ancient Mesopotamia to Egypt to China to medieval Europe, people believed your tooth pain was caused by a worm. A tiny, invisible worm living inside your tooth. They believed this worm burrowed in, chewed through your enamel from the inside, and when it wriggled, you felt pain. When it rested, the pain stopped. This belief is called the tooth worm, and it first appeared in writing around 5000 BCE, that's 7,000 years ago, on Sumerian clay tablets. The Sumerians even wrote a poem about it. The worm goes to the gods crying, asking what food it should eat. The gods say, "We give you the tooth and the gum." So the worm moves in. It sounds funny to us now, but this belief lasted for 7,000 years. Even 18th century European doctors still believed in it. Which explains every single weird treatment that came next. And these treatments get stranger the further back we go. Stay with me. If the problem is a worm, how do you get rid of it? Option 1, smoke it out. In ancient Mesopotamia, doctors would heat a mixture of henbane seeds and beeswax, then blow the smoke directly into the open cavity. The idea was the heat and smoke would kill the worm inside the tooth. Did it work? Not really, but henbane does contain mild pain-numbing compounds, so patients might have felt slightly better just from the fumes. Option 2, put a dead mouse on it. The ancient Egyptians believed placing a freshly killed, warm mouse directly on the aching tooth would draw the worm out. The Scots went further. They wrapped a live caterpillar in red cloth and placed it under the tooth. In medieval England, a common remedy was to insert a heated pin behind the ear while inhaling leek seeds and henbane through a funnel. These are real, people actually did this. But not everyone relied on dead animals and smoke. Some ancient cultures got surprisingly close to what actually works. Clove oil. The ancient Chinese used cloves to treat tooth pain as far back as 200 BCE. Doctors in the Han Dynasty actually required patients to chew a clove before speaking to them, but partly for fresh breath, and partly because cloves genuinely numb the gums. Modern dentists still use a compound derived from cloves today. It's called eugenol, and it's a real, proven local anesthetic. Ancient Chinese doctors didn't know the chemistry, but they figured out the result through trial and observation. That's actually impressive. The ancient Egyptians made a toothpaste from pumice mixed with wine vinegar. It cleaned the teeth, yes, but over time it also wore the enamel down significantly. A two-in-one problem. Various cultures across Asia, Africa, and the Middle East used chewing sticks, twigs from specific trees, to clean their teeth daily. This isn't very different from what your dentist asks you to do with a toothbrush. Now here's where the story gets really surprising. Most of these remedies were about managing the pain. But some ancient people tried to actually fix the tooth. And the evidence of this is mind-blowing. In 2015, scientists examined a 14,000-year-old skull found in northern Italy. The skeleton's name is Villabruna. When they looked at his teeth under a microscope, they found scratches inside a cavity, tiny, precise marks made by a pointed flint tool. Someone 14,000 years ago used a stone pick to scrape out the rotting tissue from inside a tooth. No mirror, no light, no idea what bacteria even was. Just paying guesswork in a sharp rock. But that's not even the oldest example. In May 2026, researchers announced a new discovery from Chagiaskaya Cave in Siberia. A 60,000-year-old Neanderthal tooth with a deliberately drilled hole in it. Not a human, a Neanderthal from 60,000 years ago. Someone used a stone drill with a flint tip to clean out infected tissue from inside a tooth. This is now the oldest known evidence of dental surgery in human history. And it was done by a species we once called primitive. Let's go to 7000 BCE, ancient Pakistan, a farming village called Mayagar. Archaeologists found 11 teeth from 9 different adults. All of them had tiny, perfectly circular holes drilled into them. These weren't cracks or damage from chewing, these were deliberate, precise. Made with a small bow drill, the same tool they used to make beads and jewelry. No anesthesia, no numbing, no mercy. Just someone spinning a flint-tipped drill into your living, awake tooth while you sat completely still. That is 9,000-year-old dentistry, done without a single painkiller. And they didn't just drill, some ancient people went a step further. In Slovenia, scientists found a 6,500-year-old human jawbone. One tooth had a crack, and the crack had been filled with beeswax. Someone packed beeswax into a cracked tooth to seal it and reduce sensitivity. That is the world's oldest known filling. Made of the same material bees used to build their hives. It might sound primitive, but the logic is actually sound. Sealing a crack reduces air, liquid, and bacteria getting in, which reduces pain. They got the right answer without knowing why it was the right answer. And when nothing else worked, there was only one option left. Sometimes no herb, no smoke, no flint tool could save a tooth. When the pain became unbearable, the tooth had to come out. The ancient Greeks designed the first known tooth extraction tool, basically a pair of metal pliers. But extraction without anesthesia in an unsterile environment was genuinely life-threatening. People died from the infection that followed. In medieval Europe, if you had a toothache, you didn't go to a doctor. You went to the barber. Yes, the same person who cut your hair also pulled your teeth with metal tongs while you were wide awake. This is actually where the red and white barber's pole comes from. Red for blood, white for the bandage. So next time you walk past a barber shop, you now know what the colors mean. Here's the twist. Some of the weird things ancient people did, we haven't fully stopped. Clove oil is still used in dental procedures today. Chewing sticks are still used in parts of Africa and the Middle East, and studies show they are genuinely effective at cleaning teeth. And that idea of sealing a damaged tooth, we still do that, we just call it a filling now and we use composite resin instead of beeswax. The difference between ancient dentistry and modern dentistry isn't really the idea. It's the tools, the knowledge of bacteria, and most importantly, the anesthesia. Because the bravest thing in history might just be the person who let someone drill their tooth with a flint stone 9,000 years ago, with nothing to take the pain away. So the next time you're sitting in that dentist's chair, heart racing, hands sweating, just remember, somewhere 60,000 years ago, a Neanderthal sat down, opened their mouth, and let someone come at them with a sharp rock. And survived. So you're going to be fine. If this video gave you a new appreciation for your dentist or made you very, very grateful for local anesthesia, hit subscribe for more weird, true human history. And drop a comment, what's the strangest remedy from this video that surprised you the most?